Good morning, everyone. Jason, if we could have my slides, thank you. So I'm going to provide a brief update in terms of the numbers, and then get into some of the key events of the past week, and then we'll have opportunity to discuss the other items as Matthew indicated. Next slide, please. So this is the summary of where we are numerically today. So this is actually as of 4 o'clock yesterday afternoon. We've tested 43,818 persons with a total of 2,288 cases. 98 individuals have been hospitalized cumulatively with a total of 31 deaths in the county. Currently, we have 32 people in hospitals. 24 of them are from our community and 8 are San Quentin inmates. Next, please. This shows the cumulative cases countywide since the beginning of the pandemic, and shows that we're obviously, since this is summative, each day we're seeing more cases, but also importantly, the slope of that curve has also increased. The yellow dotted line at the bottom represents total hospitalizations and shows that we haven't seen significant surges in hospitalizations as much as we've seen increases in cases. Next. This just offers the context for over that same interval statewide. This is actually the number of new cases per day in the state of California, and shows that we're seeing significant surges statewide, up to 10,000 cases on a few days in the past week. New cases on a daily basis. Next, please. This, just looking at that top line there, the black line, it shows the number of people in the hospital in Marin County with COVID-19. And the most important thing to note is that starting at the end of June, beginning of July, we had a significant increase, a surge. Some of that was due to San Quentin inmates coming in, but also many are, reflect our own community. And it shows that there's been a relatively stable pattern within that. After that real increase, we've been jumping between about 25 and 35 people in the hospital each day without an increase. Next, please. This is the number of the percent positive. This is something we look at very carefully to determine whether or not our increases in cases are really just due to increase in testing. And this has been relatively stable. We are now at about 7% positive in our cases. And you can see on the bottom there, that corresponds to the number of total tests we perform. So we are testing more and still need to perform more testing. But importantly, our percent positivity has not increased as after that increase that we saw in hospitalizations at sort of the end of June. Next, please. This is an important indicator that we just looked at for determining whether or not our hospitalization rates are significantly elevated relative to other Bay Area counties. So this is an indicator you won't see on other dashboards. This is a per capita hospitalization rate, and we'll be tracking this over time. And this shows that Marin County is is sort of at average in terms of the Bay Area hospitalization rates per capita. This does not include those 8 San Quentin inmates who are in the hospital currently. Next slide, please. This is our age distribution. Just one of the demographic characteristics you'll see on as we track this on the web page. Anyone can see any of that I'm sharing here on our public-facing web page. We've had 31 deaths so far. 71% have been older than age 80. Which is only 5% of our total population. So really important marker of what we've always known of the particular vulnerability of people of older age. And 75% of the deaths are people who resided in long-term care facilities. Next, please. This is the a familiar pattern for us. This is our race ethnicity distribution cases. The most dramatic pattern here is the green out of our total cases, which corresponds to people who self-identify as Hispanic or Latino. When they are tested, race ethnicity is determined for each person, and we're seeing a very strong overrepresentation of people of Latinx background in our cases. Next, please. Marin County is one of 31 counties on the state watch list. This is an initiative initiated by the governor last month to really keep a closer eye on some of those counties that were having increased transmission. Now, the vast majority of California residents live in counties that are on the monitoring list, corresponding to what I showed earlier in terms of state surges in cases statewide. The implications of being on the monitoring list is that we are under state orders now, that we cannot further advance any of the elements of the shelter in place, and certain elements that we had opened, we closed last week, which I discussed. Importantly, this status on the monitoring list has also required that we're not able to open schools as we had initially signaled we would, as much as we could in mid-June. Now, all counties that are on the monitoring list cannot open schools to classroom-based learning, but rather must open to distance learning unless they have been off of the monitoring list for an interval of at least 2 weeks. The criteria are, and where we are still meeting that criteria is in our total case rates. We have to have less than 100 cases per 100,000 residents over the previous 2-week period, and we're about twice that currently. Next slide, please. So these are the key changes of this week. We've seen increased cases statewide, regionally, and in Marin. Our hospitalizations are elevated but have been steady. We're seeing outbreaks in long-term care facilities. The San Quentin prison outbreak is slowly resolving. There have been fewer people being sent out of that prison. In fact, they're now repatriating people, bringing back from regional hospitals back into the field hospital that's been established there with about 140 beds. About 105 inmates now are being cared for on site in those beds. On July 17th, the governor announced counties on the monitoring list may not open schools, as I mentioned. Reusable bags are now allowable. So this is something we wanted to just make sure the community is aware that rather than the initial requirement that people use plastic bags or other bags, that has been changed. Now we're allowing people to reuse their own bags and encourage everyone to, as you had been before in the pre-COVID days, for the sake of the environment, bring reusable bags. You have to bag them yourself. You keep them in the grocery cart, and then when the groceries arrive, you would bag them into your own reusable bags and bring them to your car that way. Hair salons may also operate outdoors. There was some contradictory guidance around that last week that led to some confusion because the state had said it was allowable, but the Board of Cosmetology had not. That has been reconciled, and it is official that haircuts may occur out of doors. We also have a plan for increasing testing capacity this week, which we'll review shortly, and also a plan for enhanced enforcement this week, which we will also review later in the meeting. Next slide, please. And that's my presentation. Thank you.